Algernon Damasa, thank you so much for joining us. As of midweek, 50 people have tested positive for COVID-19 in Doña Ana County, and almost half of those cases are people under 40. How is the virus spreading in the county?
There's not a whole lot that we know, except that there has been community spread in the county. Some of the initial cases appeared to be travel related. There are people in Doña Ana County who travel either within the United States or out of country. We also have professors at NMSU, New Mexico State University, who sometimes entertain visiting lecturers or just visitors from out of state.
So early testing in the state focused mostly on Albuquerque and Santa Fe. At this point, is there enough testing in southern New Mexico, and how are people accessing that?
I think a good question to ask is there enough testing anywhere? For a long time, we didn't know what the extent of testing in individual counties was. The State Department of Health just started reporting that and posting it on their website this week.
And then I wanted to ask you, are there known cases of COVID-19 among migrants who are being held in the detention centers and elsewhere along the border? What do we know?
We don't know a whole lot, except that there have been cases identified at a facility in Otero County where there is a privately run prison facility right next to a privately run facility for detained migrants. And there have been cases reported there.
And do we know anything about how those people are being treated or isolated, or what do we know about how they're being taken care of?
There, we also don't know a whole lot. Prisons and detention centers do have protocols in place for isolating individuals in the case of an outbreak of an infectious disease, but how many can they isolate? And that is the problem when you have a highly contagious coronavirus for which there's no vaccine or any specific treatment yet, is that you can have cases spike really rapidly. And this is one of the reasons that the governor is trying to move some people out of prison facilities across the state.
So you reported last week that there were trailers for border wall workers in Columbus that have been now broken up and moved off. Can you talk about what was going on there and what the concerns were?
So construction on the southern border wall is considered essential business, a federal infrastructure project, and progress has continued. And what happened in the border village of Columbus was that they set up some housing, some so-called man camps, trailer housing for people who were going to be working construction on the wall. And there were some questions in the village among residents about how these people were being housed in this sort of congregate situation in the midst of a pandemic. And after a few days of intense questioning and some press scrutiny, the trailers have been broken up and moved to one location just south of the village, closer to the port of entry at Columbus. And a few trailers are also being moved to the Antelope Wills port of entry area.
Okay, so the border wall construction is ongoing. How many people are working in southern New Mexico on that project right now, do you think?
That number is probably in the hundreds. The particular trailer housing that was being set up in Columbus was going to accommodate anywhere from 20 to 80 people who wanted to live here, although they were also being given the option of commuting from the El Paso area or other parts of New Mexico where they'd been hired. So there's quite a bit of wall going up. It's a long-term project, 1.5 to 2 years in Luna County and Hidalgo County just to our west.
So you cover, you're based in Las Cruces, but you previously worked at the Deming Headlight, is that right?
That's correct. That's where I started.
And have you been tracking what's happening in Deming? I feel like Deming is a really interesting town. It's sort of struggled economically and has definitely bore the brunt of trying to help migrants. How is a town like Deming coping with COVID-19 and the threat of COVID-19?
It's very interesting. So Deming is the seat of Luna County, which is a southern border county that has double-digit unemployment even in good times for the rest of the state and the country. It's semi-rural. There is a lot of farms and ranches out here and not a lot of other kind of economic activity. Luna County only has a couple of cases currently of COVID-19, also much fewer tests, and one hospital facility that might be vulnerable if there was a sudden spike of cases in this area. So there's, the county is trying to prepare as best as it can. At the same time, there's also a public interest campaign just to get people to understand that what's happening in the rest of the country and the rest of our state is a reality and does present a public health threat to the community here.
Your beat also covers Grant County and over towards Silver City. How is it doesn't seem like there are a lot of cases in Silver City. I think there's 10 right now. What are some of the concerns in Silver City as they're getting ready?
So there are 10 cases total in Grant County, which includes Silver City, but also some of the neighboring communities of Mimbres and Santa Rita. Santa Rita, of course, is notable for the presence of copper mining. And the Chino mine, which is owned by the Freeport-McMoRan company, has actually suspended operations until further notice because there's been a cluster of cases identified there. And this is a site where workers, employees, and contractors from different counties of the state, as well as residents of Arizona, have congregated to work. And this work initially went on because it was essential business, but that operation has shut down for at least a couple of weeks, and they've been testing employees and contractors who worked at the site to try to identify and isolate people as quickly as possible.
Hey, Algernon, thank you so much for your work keeping us informed on everything that's happening in southern New Mexico. Be safe. Thank you.
It's a pleasure, Laura. Be safe.